everybody, it's me. I am giving you an update after my SIS. This post comes from my husband's side of the bed because I am on some bed rest. Unfortunately, the procedure didn't go exactly as planned as far as, pain and all that stuff, but they did get the images that they needed finally. When I went in, they had they didn't have the correct catheter. I guess the one that they normally use has a balloon on the end of it, and they somehow stick it up there, inflate the balloon, and then fill it with saline. I don't know. But they did not have any of those. They called around to the different areas of the hospital. Nobody seemed to have any. So they used just a shepherd catheter, I guess. That's what they called it. Could be wrong, I don't know. And um, it hurt very bad. So what they did basically was they started out with a normal, just internal vaginal ultrasound, just to kind of see where everything was situated. They noticed when they did that my cervix is actually tipped backwards, and then so I guess I'll try and show you. If here's your normal cervix right here, and here's your uterus, it normally kind of folds this way in your body. So it's kind of straight up and then it kind of just lays forward. Mine actually tips backwards like this, and the top of my uterus is kind of folded underneath, and then the whole thing is rotated on its side and tipped over. So that gave them quite a bit of difficulties, just in positioning and whatnot. So after they did the exam, everything looked normal to them. There were quite a few follicles growing on the right side, not as many on the left side. They also said that my left ovary is long. I don't know what that means. They didn't really tell me, but I guess we'll find out in a couple days. And then they inserted a speculum, opened me up. They grabbed my cervix with some pinchers and kind of held onto it while they opened my cervix enough to get the catheter in. Once it was in, they tried to inject the saline solution. They did a lot of saline. I think they tried 12 cc's of saline total in the first attempt, and it all just came right back out. It never filled the cavity or anything. So they tried to get the pictures. The doctor looked at the ultrasound pictures afterwards and said that it wasn't good enough. So they told me to come back, they told me at first that they wanted me to come back in a few weeks after I've ovulated, but then they decided that they were just going to try it again and give it one more try before they made me come back, because I was already there. I had already taken the day off of work and whatnot. So they tried it again. So they reopened me up, and they tried to get the catheter back in, obviously a sterile catheter, not the one that they had just used. And for whatever reason, it actually would not go in. So they used this long green stick looking thing, and they basically kind of screwed it into my cervix to make it open and dilate it enough to get the catheter in. Once they got the catheter in, they pushed it up so that it was into my uterus, not just kind of on the edge, and they got in quite a bit of fluid, a lot of fluid actually, and they actually did get it to fill the cavity partially, not the whole way, and they got the images that they needed, or they say they needed, and everything came out fine besides the pain. I just cried the whole time. And we were given the go-ahead to try again, or to continue trying. There's nothing wrong with my blood, there's nothing wrong with my uterus, there's nothing wrong. It just seems like bad luck, maybe. And so they told us we can go ahead and try again this month and see what happens. So we're gonna do that. I I called the doctor yesterday because I've still been having a lot of pain and a lot of cramping in my abdominal area. And if I kind of wiggle my stomach around, you can feel the liquid still in there, like splashing around. So I called them and they said that given my history of pelvic pain, that um, the SIS procedure was bound to be painful for me. But because I had two of them, it really increased the amount of pain that I'm feeling just from the pelvic pain that I already have. And so that's why I'm on bed rest. I have to stay in bed pretty much this weekend, and hopefully by Monday I'll be feeling better. Fingers crossed. Um, and we'll kind of go from there. I already have an appointment set up on Wednesday for my shots for this next month, basically, where they go in and do trigger point injections into my abdomen and then up through the muscles on either side of my vagina. Yeah, it's painful. To do nerve blocks to relax those muscles in there. So that's on Wednesday. So hopefully we'll find out more on Wednesday. And if I'm not okay, then I already have an appointment, so I'll get okay soon. I did get some pre-seed. Kind of bit the bullet on that one and got it. We tried it out this morning, which probably wasn't the best idea considering the whole bed rest thing. But I felt better for a while. Good old endorphins kicked in. We just used it as a lube because I wasn't really interested in reading the directions in the heat of the moment on what you're supposed to do with it. So I guess we'll see in a little bit, in the next couple of days, if that's something that we want to continue trying to use or not. I also took an allergy pill this morning because my husband's dog is staying with us, and I've been noticing that I'm getting kind of congested and kind of, itchy eyes, runny nose, stuffy nose, that kind of stuff. So I took an allergy pill. I know that those are supposed to kind of dry up your cervical mucus, so I also took some Mucinex, which I've actually been taking for a while just for a sinus problem that I have going on. So I guess we'll see how my mucus kind of plays out as to how much of the pre-seed we actually use. And other than that, we're just kind of, taking it day by day. I'm still about a week away from ovulation, maybe a little bit more, maybe a little bit less, just depends on what my body decides it wants to do. You know how that goes. And so we're really going to start entering into our fun time. Not that we don't have fun year round or, all throughout my cycle. From basically when I stop bleeding until when I start bleeding, it's basically a free for all, and we just have as much fun as we can. And, it's worked out a couple times, so I don't see why it couldn't work out again this month. We're really hopeful for this month. We really both are being very positive and have a great outlook that this is going to be our month to finally get a baby to not only get to a heartbeat, but to stick in there for 9 months. And I mean, I guess we'll see what happens. If it happens, it happens. If it doesn't, it doesn't. And, just kind of go from there. And we'll see what the fertility doctor says on the 10th and see what my other doctor says on the 6th. And just kind of go from there. So that's basically how we've been doing, and I will update soon. Talk to you later.